Hello, welcome to this lecture on the community assessment. This lecture provides an overview of the process of community assessment, and at the end of the lecture, you should be able to describe the relationship of community assessment to the implementation of public and community health programs and to program evaluation, to identify and describe approaches to conducting a community assessment. You should also be able to describe a literature review as a component of the community assessment, explain the value and role of stakeholders in conducting a community assessment. So, by way of introduction, public health concerns such as high or detectable morbidity or mortality rates among a specified population may result in attempts to address the problem by proposing solutions and developing interventions. And from the perspective of an evaluator, the intervention that is developed requires appraisal on two levels. First, it requires that the problem be specified. That means who is affected, why are they affected, how many members of the community are affected, and secondly, an understanding of the assets and resources that are available to address the problem is required. So a community assessment determines the extent of the problem and proposes the most feasible and viable and effective solution or a combination of solutions to address the problem both adequately and appropriately. So a community assessment depicts the perceived and actual needs of a given population and their assets and resources for the development of a public health initiative. It precedes the evaluation process in the participatory model for evaluation as shown in this figure. So community assessments are an important and integral part of program planning and are conducted with the community as the focus. The community may be a geographical, faith, racial, ethnic, school, professional, or cultural community, to name a few. The community assessment is part of a cyclical and iterative process and precedes the selection, development, and implementation of the initiative. So a community assessment may also be required following an evaluation to identify additional community needs, assets, and priorities, and to determine the next steps for program development. So the assessments may, in addition, herald the refinement of the initiative or the start of a new one. So why conduct the community assessment? What's the purpose of a community assessment? Number one is to identify where the problem is most prevalent. There's also another reason to identify the people or the group of people who are most affected by the problem or involved with the problem. Thirdly, to identify the factors that produce the problem at the individual, physical, and or social environmental level. And then to assess individual and community needs and aspirations, and to assess the community's readiness to address the problem, and to assess the level of resources that are available within the community to address the problem, and to obtain data that can be used to support the development of the initiative and provide the baseline against which any changes in the problem may be assessed. So a community assessment can also be described as a situation analysis that may produce an extensive appraisal of the affected community. And for the assessment process to be empowering and to benefit the community, and some authors have advocated that it be of the community, by the community, and for the community. And so an important aspect of this approach is that the community is involved in the process, and the findings are provided to the community and can then be utilized by the community for decision making. So because a participatory process is likely to result in the development of sustainable community-driven solutions to the problem, questions that are important to the community should be incorporated in the assessment process. And such questions may include what are the history, economic welfare, and leadership of the community? What individual characteristics, behaviors, and practices contribute to the problem? And do people have access to the basic amenities that support healthy living? And to what extent do equity and fairness exist in the community? And what is the nature of civic associations? And to what extent do they support all facets of community life? Um, how do the social and physical environments affect the health and well-being of the community? And what is currently being done to address the health issues and concerns of the community? What services are provided? Who participates? And the cultural life of the community. What is it like? And what is being done to minimize the impact of environmental hazards on the community? And who are the so-called movers and shakers of the community, and the people who get the things done, and whom others in the community rely on for information and resources? So these are some of the questions you would want to ask. It is looking at theoretical considerations. It is useful and to conduct the community assessment using a theoretical framework, and because public health programs and policy initiatives are best developed using a strong theory. Examples of theoretical approaches for conducting a community assessment and are available in the scientific literature. And so community assessments may be based on one or a combination of individual, interpersonal, or communal theoretical models of health behavior change. And so the conclusions that are drawn during the community assessment describe the relationship between the factors that cause the problem and the available resources. And so the most commonly used theories of individual behavior in public health are the Tian's theoretical model, and social cognitive theory, and the health belief model, the theory of planned behavior, and social support theory. And at the community and group level, community organization and community building are important concepts in the absence of a single unified model. So this table provides an overview of the major concepts from the models we have just listed. And other theoretical frameworks have been used in public health, such as the Anderson model, which explains people's utilization of health. So if you take one of the theories listed there, the first one, trans theoretical model, which is based on an individual's changing behavior through stages of readiness. These are the major concepts that this theory talks about: pre-contemplation, contemplation, preparation, action, and maintenance. So when a theory or a theoretical framework is used for the community assessment, the same theory may be used in the program and in the development of the program. And so the value in using a theoretical framework for program development is that it increases the likelihood of incorporating the factors that are known to result in the change that the initiative seeks to bring about. Historically, behavioral theories have have been the primary drivers of initiatives to address public health problems. However, recognition of the social and environmental factors that influence health has led to the use of an ecological systems perspective, and which incorporates individual and environmental factors in its analysis. So the assessment may incorporate concepts from theoretical frameworks at each of these levels of the socio-ecological model. And the socio-ecological model allows the integration of multiple theories and models as needed. It indicates that it is not sufficient to look at individual factors in the community assessment, precisely because organizational and community factors also play vital roles. And so the ecological model may be used to provide guidance for a comprehensive approach to community assessment and program development across multiple domains of behavioral influence. At the individual level, behavior is influenced by biological, physiological, psychological, and emotional states. At the interpersonal level, structural factors and social and cultural norms of peers, family, and friends play a role. The organizational, community, and policy domains recognize the influence and impact of multiple environmental factors and behavior. So determinants at this level include economic, physical, and structural factors and systems that influence health outcomes. So where people live and where they work and play significantly affects health outcomes. In addition, the social determinants of health include conditions that lead to inequality and injustices that increase the risk of disease and disability, and influence individual collective health and well-being. So social cohesion, social inclusiveness, social capital, and trust are also factors in determining health outcomes. So using the ecological model as the guiding framework for community assessment allows these concepts to be included. And these factors that influence health have to be borne in mind. And so incorporating core principles of the ecological model in behavior change models leads to behavior change through appropriate and behavior specific interventions. Data for a community assessment are collected from the population of interest to determine the incidence and prevalence rates of diseases and the extent of the problem. So rates of diseases and disability are described as number of cases per 1,000 or per 100,000 of the population. In addition, risk and protective factors associated with the public health problem are identified and described. And the risk factors are those personal and environmental factors or determinants that increase the likelihood of an individual coming into contact with or being exposed to conditions that lead to disease or disability. Protective factors are like mirror images of the risk factors. So when they are present, they provide protection against the risk of or the exposure to the disease or disability. So in addition to identifying risk and protective factors, a community assessment must identify human, material, and economic assets, including formal and informal community-based organizations and networks that are available in the community to address the health problem. The assessment includes demographic, social, economic, structural, cultural, and systems factors that affect the population of interest and the community as a whole. The assessment contains information about the state of the community, access to and delivery of services, cultural and social norms and practices, as well as the economic situation. So data on the economic situation of a community includes not only the educational level of the population of interest, but also the types and locations of the jobs that the community offers its residents, whether they are low paying or high paying jobs. So such characteristics of the community structure and systems infrastructure are an important gauge of the community's ability and willingness to support public health efforts. So determining the resources in the community identifies important allies for addressing the problem, and supporting sustainable, culturally appropriate initiatives that are congruent with the reality of the community and the lives of its residents. So the community assessment is conducted using both qualitative and quantitative approaches, and data are collected to understand the community's expressed and observed needs for health and social services. And carrying out a community assessment requires that the researchers follow a process and that involves multiple stakeholders and uses multiple data collection sources and methods. So the steps for conducting a community assessment are outlined here. And the first step is to establish a team. And so conducting a community assessment based on a participatory model requires equitable involvement by the community. And the first step in the community assessment process is to engage those who are most affected by the problem and professionals who provide community-based services. And the team consists of people who live within the community or who have an interest in the assessment that is being conducted. So members of the team should include those who are familiar with the problem, who are familiar with the research methods, who know something about the data collection approaches and data analysis. And the team members' roles should be identified so that each person is able to contribute to the process. Members of the community also could bring expertise and important perspectives with regard to the community and the population and the risk factors associated with the problem that is being assessed. So the team decides on the task and specifies the aim of the community assessment. Should it be a broad assessment to determine the major problems or issues within the community, or a narrow assessment of a specific problem? And for example, if the problem is high rates of underage, alcohol-related vehicle accidents, motor vehicle accidents, then the team needs to understand which groups are most affected, how, when, and where the accidents occur, who might be facilitating the problem, and the best approaches for addressing the problem from the perspective of the community. Step two is to determine the availability of data. So once the aims of the community assessment have been established, the next step is to determine what information already exists. So data are regularly collected by not-for-profit organizations and by state and local agencies, and this should first be reviewed to determine what information is already available about the community. So this data may be in multiple forms. They may be in databases that have to be analyzed, or in reports that have to be compiled. So the quality and the quantity of the data may be mixed and may be limited to small areas or one population zone. So the team must assess how useful the existing data is and whether they serve the purposes of the group. So if the intent of the group is to understand the factors leading to the problem in the whole community. But the previous assessment was conducted only in the local high school of 500 students, for example. It will then become important to collect additional data on other members of the community. So alternatively, given this same example of underage drinking, data on the community may be available at the state level, but does not give any specifics for youths. So collecting primary data from youths will then be important to support the development of the intervention. Secondary data may be available to answer some of the questions, but the team may need to collect additional data. So using human subjects in a community assessment may require that the team has its proposal reviewed by an institutional review board. Usually these boards are found in universities and other research organizations, and sometimes they are called ethics committees. The next step is to determine which data are missing and need to be collected. So after a full review of the existing data, a determination is made by the team of the additional data that needs to be collected for the project. So through group consults, a list is compiled of the information that is available and of the questions that still need to be answered. Questions may include what are the problems or issues in the community and in a specified area or with a particular group, and how does the problem or issues affect different members of the community, and how prevalent is the problem among members of different groups and by age, gender, race, profession, educational level, socioeconomic status, and so on. And what are the factors that increase or decrease the occurrence of the problem? And what are the individual, personal, and community, organizational, or policy factors? And what resources, human, material, and financial, are available within the community, as well as outside the community, that can be brought to bear on the problem? Who are the people and what are the systems and structures available and ready to address this problem? And how does addressing the problem address issues of social justice? So it's important to collect only the information that is needed and that answers the overarching research question. So it is both a waste of resources and a waste of participants' time if data are collected and that will not be used for the program development. Step 4 is to decide on the data collection approach. And the data collection approach that is used to conduct a needs assessment takes the needs of the project into consideration. So the data that are collected may be quantitative or qualitative, or a combination. So suitable data are those that provide evidence for answering research questions. For example, if the question to be answered is what are the factors that influence youth drinking, the data collection approach can include focus groups with youths and their parents, as well as other key informants like law enforcement. In addition, a survey could give valuable information on the extent of the problem. So the factors that determine the most appropriate approach for answering the question or questions, and hence the most appropriate data to collect, include the size and scope of the project, the study subject, the kind of information that is required, and the resources that are available for the project. Let's look at these factors a little bit more in detail. So the size and scope of the project. This size and scope of projects are influenced and to a large extent influence the data collection approach because the larger and more spread out the population sample, or the more factors being assessed, the more likely that a quantitative data method collection will be selected. Qualitative approaches may be used to complement quantitative approaches and large studies. So in small studies, qualitative approaches may be used alone. Using the ecological model framework, which includes an assessment of factors at all levels of behavioral influence, and also increases the size and scope of the study and in several ways. So it increases in both the size of the sample and the scope of the project have implications for the measurement approaches that may be appropriate for assessing each dimension. The study subjects, so the kind of subjects in the study also influences the approach used in understanding the high rates of obesity in a community, for example. It's important to obtain information from individuals as well as to do an environmental scan of neighborhoods. And in this case, the study subjects include both people and locations. So collecting data from individuals involves using surveys, individual interviews, focus groups, among other methods. And the environmental scan can take on multiple forms. For example, assessing the number of fast food restaurants or convenience stores in the neighborhood, or observing the type, quantity, and quality of food that people generally choose to eat. And another consideration, the kind of information required. So the kind of data that are collected is determined by the type of information that is needed. And studies of knowledge may be easily assessed using surveys, and while understanding attitudes towards the behavior may be more easily assessed using focus groups. And behavior, however, may be less reliably assessed using self-reported surveys. So observing the behavior provides a more objective evidence. And assessing the extent to which grocery stores and farmers markets are available within a community lends itself to using a combination of qualitative and quantitative measures. And so the kind of information required may suggest the use of a photograph and digital storytelling also. And so the availability of resources too is another important consideration. So the financial, material, and human resources that are available for a project influence the amount of data and that can be collected. And so the data collection approach must also provide the inclusion and training of members of the community, because community members can be trained to develop the data collection instruments and to collect and analyze data. So in general, it is critical to use the most appropriate and cost-efficient approach to collect the most useful data. And so it does little good to collect data using a survey because of limited resources if using a survey will not help you answer the research question. So step 5 is to develop and then secure data collection instruments. So the questions that need to be answered as part of the community assessment will determine the data collection instruments and that are most appropriate. And like I've said, using surveys allows the team to collect quantitative data and to draw conclusions about the problem in terms of numbers, so frequencies, means, and then doing univariate analysis. Other instruments allow qualitative data to be collected on perceptions and depths of feelings, experiences, attitudes, beliefs, and behaviors using qualitative approaches. So these instruments can also provide information on the quality of a product or an operation, exposure to an initiative or condition, and adherence to a task or behavior. So the instrument selected will determine who should provide the data. And because data must be credible, it is important to ensure that the appropriate persons and sites are selected. So participants who experience a problem are likely to be the most credible for describing the problem. But in the assessment of the assets to address the problem, other people may provide different perspectives. So data obtained from multiple sources and collected using reliable tools increase the validity and credibility of the research. And some of these tools include focus group discussions, which are useful for obtaining information quickly and for understanding broad perspectives. Focus groups are homogeneous groups of 6 to 8 individuals who convene to answer open-ended, predetermined questions. Individual key informant interviews are used to gather information from individuals who are either affected by the problem or who can provide an independent perspective. Individual interviews are often carried out with opinion leaders who need to be included in the community assessments and because of their unique perspective, but whose status in the community makes it preferable and that they are not included in focus groups. So individual interviews are often quicker than focus groups because interviews can be scheduled more easily with one person and than with six or more and coming together. So photo voice is a qualitative data collection technique in which the data are collected by members of the community and using cameras, and the photographs are discussed to highlight issues that the photographer identifies as relevant for describing the problem. We also have digital storytelling, which utilizes audio or visual recordings and is developing into a popular approach in community needs assessment. It allows the participants to document the problem and their experiences in their own words. They can provide strong testimonials that support the development of initiatives. Asset maps can be used to identify and document physical or human resources within the community and that may influence the problem or provide venues for intervention, for example, churches, schools, health facilities, and businesses. Assets are mapped to show the quantity, distribution, and accessibility of the resources to the population of interest. So a mapping of stores in low income neighborhood could show the number and location of food outlets compared with shops that sell alcohol, for example. So inducting a study of the accessibility of, including a study of the accessibility of fresh fruits and vegetables in a community that has high rates of childhood obesity. An asset map might include the availability of produce in corner stores and convenience stores, farmers markets, grocery stores, and school vending machines. In conducting a study of the accessibility of um, in conducting a study of the accessibility of fresh fruits and vegetables in a community that has high rates of childhood obesity, an asset map might include the availability of produce in corner stores and convenience stores, and farmers markets, and grocery stores, and school vending machines. So, in addition, the skills, talents, and expertise of the community leaders, the heads of agencies, organizations, businesses, churches, schools, may be tallied to determine the level of resources that are available within the community for addressing the problem and developing the initiative. So information on the instruments that can be used can be obtained by reviewing the literature and contacting others who have conducted similar studies. Surveys and other data collection tools may also be developed for specific initiatives. Although the process is time consuming, and developing a good instrument requires a certain amount of expertise. Quantitative and qualitative data collection methods will be described in detail later in the course. So step 6 is to develop the data collection plan. And a data collection plan describes the steps that are required to ensure that data are collected. And so it includes components such as the data to be collected, and the methods for collecting the data, the sources of data, persons responsible for each role. And so a data collection plan may also be an activity plan that outlines the time frame for data collection. And step 7 is to secure resources for the data collection plan. So once the team has decided on the design for the community assessment and has developed the plan, the resources for implementing this plan must be secured through grants and donations or budgeted activities. And the resources include the personnel, the staff and volunteers for conducting the study, salaries and stipends for staff and volunteers, transportation, data collection instruments, interview space, equipment, supplies, and materials. And so step 8 is to implement the data collection plan. Well, at the implementation stage, it is assumed that all the resources are available and the materials have been developed. So the study participants have been notified or recruited as required by the method, and the instruments are available and ready for use. So the leader of the community assessment team is responsible for ensuring that data are collected, and the leader may recruit other members of the team to participate in the data collection or recruit and train others. Step 9 is to analyze and interpret the data. Interpretation and analysis of data that have been collected for a community assessment are determined by the type of data that has been collected. So quantitative data can be analyzed manually if the sample size is small, or by using computer-assisted mechanisms such as Microsoft Excel or SPSS. Determining the frequencies, the means, standard deviations for the data, and describing the sample is the first step. So depending on the level of the data collected, whether they are ordinal, nominal, scale, or ratio data, and the sample size and the questions asked, other types of analysis may be undertaken, including univariate, bivariate, and multivariate analysis. So if the community assessment is made at the beginning and at the end of intervention, a paired test, like a paired t-test, may be appropriate. So graphs, charts, and maps provide a visual representation of the results. Qualitative data is also analyzed using manual or computer-assisted approaches, and evaluating qualitative data requires content analysis to determine themes. And the themes form the basis for the reports and provide answers to the research questions. So the interpretation of the findings is based on the information that the community assessment set out to get and the likely use of the data. And if the focus of the intervention is behavior change in the population, then the reports may include such details as frequency of the behavior, the context of the behavior, environmental conditions under which the behavior is carried out, approaches to addressing the behavior and internal and external resources that might support the intervention. If, however, the approach is policy oriented, then the focus of your report is the information required to frame the need for the policy and the populations or setting that the policy should target. So a community assessment of the physical environment could include a photo voice approach to data collection and then understanding multiple perspectives. So policies leading to social change require a process that includes community and policymaker education, advocacy, and community mobilization, as well as action. So, understanding the requirements of the initiative for each component is critical to undertaking a meaningful policy change process. And the analysis and interpretation of the data collected during the process is based on the needs of the project. For example, data may be collected to assess community mobilization and action. And data collected might include who are mobilized, the numbers, the location, and the number and type of actions that we are taking as a result of the mobilization. And data to be analyzed may range from the level of participation at events to actions taken as a result of email alerts. It may also include analyzing data collected from policymakers with regards to the outcome of the actions. And this data may be in multiple forms, which includes quantitative and qualitative formats, and must be analyzed in ways that are appropriate for the method of use. The number 10 step is use the information to frame the intervention. And so we have completed the assessment. We now need to translate it and find a way to make sure that it's been able to be translated into a public health program. And so this is the usual final step, and using the information that we have obtained from the research to frame the new initiative. And the data provide information regarding the people affected and where they live and work and the factors that predispose them to the problem, as well as those that enable or reinforce the problem. So the data also includes information about the human, material, and financial resources for addressing the problem. So what are the data sources? When community assessments are conducted, primary or secondary data may be used to assess the problem and to determine who is most affected. Primary data are collected for the purpose of the particular study, and secondary data are existing data collected for a previously defined purpose. So primary data for a community needs assessment are gathered using quantitative or qualitative approaches. It is especially important to use primary data when information about culturally diverse populations is limited and specific information is required to ensure the development of culturally appropriate interventions. Existing qualitative or quantitative data collected for other purposes may be available. So the advantage is that using secondary data is less time consuming and less expensive than collecting and analyzing primary data. The primary data collection utilizes a variety of methods, including self-administered surveys, case studies, observation, focus group discussions, and individual interviews. So data may be collected using face-to-face, telephone, or web-assisted technologies. And less formal assessments than these may take place when driving or walking through the community, conducting an initial visual assessment, or for example, or in community meetings, and when using participatory research approaches such as narratives, photo voice, and theater, music, dance, puppet shows, and storytelling. And so, large health related assessments and existing local and state databases, in combination with census data, provide valuable information for estimating the extent of a public health problem. And in using secondary data, it is important to check its validity, the source, and sample size, and the nature of the sample. So other considerations in the use of secondary data include how closely the data match and the public health problem being assessed, and the extent to which the data reflects the local situation. So secondary data may be obtained from death certificates, diseases, disability and crime surveillance, health records, and surveys. Useful indicators are vital statistics, birth and deaths, age-specific death rates, and disease-specific morbidity and mortality rates. And secondary data that may be available at states, county, and in some cases zip code level includes HIV/AIDS infection rates and AIDS diagnoses, teen pregnancy rates, cancer rates, birth and death rates, obesity rates, heart disease rates, and crime rates. In addition, health and wellness data may be available with indicators such as socioeconomic, environmental, and behavioral factors that influence disease risk, access to healthcare, and utilization of health and social services. And so these factors may include educational levels, household income levels, nature and levels of contamination of air and water, service utilization. Quality of life indicators such as educational attainment, employment, income, housing, and human rights provides information about the public health problem and the opportunities to consider holistic approaches. And census data, which we can get from census.gov, provide demographic information for the United States and down to the county level, and other community level data may complement census data. Applications of geographic information systems mapping technologies provide a unique profile of the community by combining information from primary and secondary data sources with census data. In addition, specific points of interest can be mapped using these systems to produce an asset map of the local community at zip code level. Now, we'll briefly look at comprehensive community assessments, and multiple models have been described for conducting such comprehensive community assessments, and data may be collected using a variety of tools. One example of a community assessment that is commonly used by local public health agencies at the city and county level is the mobilizing for action through planning and partnerships and MAP process. The tool was developed by the National Association of County and City Health Officials, NACHO, in collaboration with the US Centers for Disease Control and Prevention. And so the cyclical MAP process is organized in 6 phases and contains 4 major components of the health assessment, and that's community themes and strengths assessment, local public health systems assessment, community health status assessment, and forces of change assessment. So community themes and strengths assessments provides insights into issues such as perceived quality of life and the identification of assets and resources to address problems using a qualitative research approach. The local public health system assessment assesses the structures and systems within the community that provide services, and as well as their own the capacities of these structures and systems. The community health status assessment provides quantitative data on a wide range of health indicators. And then the forces of change assessment identifies forces and actions external to the health system and that affect the health of the community. And more information about the MAP process can be obtained from the Nature website. So, in addition to collecting primary data and compiling secondary data, a community assessment incorporates an extensive search of scientific literature. And this review identifies known behavioral, epidemiological, and social, cultural, and environmental conditions associated with the public health problem, at the local, state, and national levels. So it identifies current conditions and historical trends, local and web-based library resources, and the systematic search of the published research provide an opportunity to compare problems in the local community with the state and national trends, and to understand the rationale for the initiative you intend to embark upon. The literature review is focused and specific, and is used to answer these questions. How does the community's assessment profile compare with the profiles of other communities of similar size and demographics, across the states or nationally? And what are the most appropriate, logical, and evidence-based ways to address the problem that the community identified? So, conducting a review of the literature is a systematic process that involves a number of steps, including identifying the topic and the search terms, researching the publications, and synthesizing the literature. Published peer-reviewed literature is searched using traditional library or online researches and resources such as Medline, PubMed, or ProQuest to find relevant books, professional journal articles, and technical reports. And peer-reviewed research is also available through advanced Scholar searches using the internet search engine Google Scholar. So, for example, if the research topics are heart diseases among adults and the relationship between heart disease and physical activity, and the search terms may include heart disease, incidence and prevalence, heart disease and adults, heart disease and physical activity, heart disease and exercise, heart disease and gender, heart disease and risk factors, and so on. So a more refined search using these categories, but with women, will provide a more focused review of the literature. And in addition, the search may provide insights into theories that the program may adopt to provide an understanding of the public health problem, at a local, state, or national level, as well as into the relationship between the problem and the resources and activities and that we needed to address it. So, and when the search is conducted and research articles are located, the researchers review references from the previous 5 to 10 years and based on the topic and the appropriateness and relevance of articles for their work. Selected papers are reviewed closely and summarized by providing the information such as title, author, journal, book, report, publication, information, the study or intervention design, that is the type of intervention or type of study population or sample size and so on. In addition, the summary contains the research questions, the variables, and the data analysis approach, and statistical methods, and the results of the study, and then significant findings. And so issues of reliability and validity should also be noted. So when the search is complete and there are enough articles to provide a sufficiently detailed background to the problem and its potential solutions, and literature review is written. And literature review is a synthesis of all the papers reviewed with regard to a specific research question. And this synthesis consists of analyzing and interpreting all the findings and summarizing those findings into unified statements about the topic reviewed. The literature review may be organized under appropriate headings to capture the overall theme of a paragraph, and each paragraph must be linked to the previous paragraph by a suitable transition. And the review of the scientific literature is a component of the community assessment reports, and then later will form part of the introduction and background section of the evaluation reports, after the intervention or health program has been implemented and evaluated. So let's look at the report of a community assessment. This is a summary of the results of the assessment and the review of the scientific literature. It is a discussion of the priorities for addressing the public health problem in a considered and logical way. The results of the quantitative data analysis are shown in narrative form, as well as in charts, tables, and graphs to ensure easy understanding. And qualitative data are summarized, and samples of the data are presented as quotations to allow the reader make independent interpretations. And the easier the report is to follow, the more likely to be used. And so the report outlines the research approach, the results, and discussions of the results and their implications. So next we outline the components of an assessment report. And the literature review section describes the public health problem or problems being investigated from the perspective of the existing literature. And so you want to include items such as the rates of disease or disability in the community compared with the states and national rates, trends in the prevalence or incidence of disease and disability in the community compared with states and national trends, and the social, economic, and cultural environment that drives the problem or the condition of importance, and peer, family, community, institutional, policy, structural, and systems influences that are associated with the problem, and the risk and protective factors associated with the problem, as seen also in the states and national data. You also want to include community, institutional, public policy, structural, and systems factors that influence the problem. So in addition, this section describes the human, material, and economic assets that are available in the community to address the problem, such as individual knowledge, skills, and resources of the community members, agency personnel and others, interpersonal actions and norms, existing community resources and services, institutional resources, both financial and material, and the resources for developing public policy. Furthermore, this section suggests potential community-based, culturally appropriate ways to address the problem in the most comprehensive way. And finally, it discusses limitations that may have resulted in bias in the study and in its conclusions. For example, small sample size, inappropriateness of the instruments, and loss of study participants, and so on. And so such issues may affect the researcher's confidence in the results. So there are multiple opportunities for stakeholders to participate in a community assessment, consistent with the participatory model for evaluation. Identifying and engaging stakeholders occurs in the first steps of your assessment. Representatives of all stakeholder groups should be involved in the community assessment process from the start, so that they have a sense of ownership in both the process and the product, or the outcome of the assessment. And so including a map of community assets in the process allows stakeholders to identify and mobilize existing community resources to address the community problems. And stakeholders can have one or more roles in the process, and they may initiate and conduct the community assessments or serve as participants in the study. Stakeholder involvement may include designing the study, the data collection methods, and the instruments, as well as collecting or providing the data. Some stakeholders may not be directly connected with the program, but they can provide valuable perspectives. Some investigators have involved stakeholders as key informants in the analysis of emerging themes during their research. And some stakeholders are intimately connected to the problem, and they are able to bring the core values and unique culture of the population of interest into focus. So these kind of stakeholders have insight into how they experience the problem, the risk and the protective factors, as well as the community, institutional, and policy structures that influence the public health problem. So an important stakeholder group that emerged in the early years of the HIV/AIDS pandemic and was those who were infected and affected by HIV/AIDS. They became important advocates for their own needs and important partners in the fight against the spread of HIV and the provision of treatment for those infected. And they have become contributors to the process over the years, providing guidance and resources in addition to being participants in research. So stakeholder participation is critical for ensuring that the sample population is knowledgeable about the study and is willing to participate. In small and rural communities, previous knowledge of a research activity often facilitates data collection and ensures that there is appropriately obtained informed consent. Information about an impending community assessment can be provided in community meetings and in print and electronic media. So it's important that the potential study respondents understand the value of participating in the study and to ensure valid and reliable information and to inform decision making. So in summary, public health programs and initiatives are developed in response to public health concerns when individuals, organizations, or agencies identify a problem or problems to be addressed. And conducting a thorough community assessment that includes both needs and assets ensures the identification and development of suitable approaches for addressing the problem. The community assessment is part of a cyclical and iterative process. It precedes the initiative's implementation and or follows the initiative's evaluation. Using a participatory approach by including community members and those who are most closely associated with the problem ensures program development and implementation that are both culturally appropriate and sustainable. And community assessments include factors that influence health at individual, interpersonal, community, institutional, and public policy levels. Reviewing the scientific literature provides a broad perspective of the problem and of who are affected, of why, how, and when they are affected. It also provides guidance for influencing the problem. And data for a community assessment may be primary or secondary data and collected using qualitative or quantitative approaches.